Folks, so glad to invite a guest today. I don't know that I've ever actually spoken to on the podcast a reporter, a health reporter. So this may be a first. Jess Craig is a health reporter at Straight Arrow News. She's worked as an infectious disease epidemiologist and also as a health security technical advisor to U.S. government agencies like the CDC, the USDA, USAID. She's also been a freelance journalist for the last few years, covering science and health for various outlets, including as a reporting fellow for NPR. Jess, very, very excited to have you here. How are you today?
I'm doing well. Thanks so much for having me.
So, you wrote an article which I actually read when it was published last month, January 14th of 2026 in Straight Arrow News. And the title is Why More Doctors Are Billing Their Patients Like It's the 1920s. Why more doctors are billing their patients like it's the 1920s. What incarnation are you talking about? What could you give an example of that so folks are clued into what you're talking about?
Sure. So, I was interested in understanding what happens to patients in the United States when their health insurance doesn't cover something. And I found a surgical center in Oklahoma who bills their patients in cash. There's no insurance. They don't accept insurance. Their price is listed on their website. You go in, you get a surgery, you pay $10,000, $14,000, you get the surgery like you would buy, popcorn at the grocery store. And it turns out that that movement, sort of called cash-based clinics, often called also direct primary care in the primary care field, is growing pretty quickly. And it's essentially physicians in many different specialties who are turning away from health insurance and are returning to the pre-health insurance days of the early 1900s, and just simply not accepting insurance, and they are charging their patients a cash price. And that really intrigued me. I think we all know that the price of healthcare in this country is absurd and only growing. And so I wanted to understand if this was a feasible solution. At first, the thought of paying for all of your medical expenses out of pocket, you're like, there's no way. I've gotten medical bills that are in the hundreds of thousands of dollars, but it turns out that it might be more feasible than you might think.
And yeah, a couple of questions. First, this isn't a flash in the pan movement. That surgical center that's been billing directly, patients, as you say, they put the prices. They're transparent. Folks can actually go to the website. How long have they been around? It's quite a few years. And the movement, like you say, it started with them, or at least they were one of the forerunners. And now there are dozens, if not hundreds, of surgical centers around the country that have followed suit and basically are putting a menu up there. These are the fixed prices. We're not going to get any other bills, and it's all bundled. Is this 5, 10, 15 years? How long has this been going on?
So I interviewed an anesthesiologist who founded the Surgery Center of Oklahoma, and he was doing this work in the 1990s. He actually founded his practice
Wow.
in 1997, and he told me he and a colleague who was also an anesthesiologist, they recognized that they were anesthetizing patients who were going into huge debt to pay for life-saving necessary surgeries. And they sort of put their heads together and they thought something has to be done here. And so they came up with this concept that they wanted to have a cash-based surgical center. And Keith Smith, who I interviewed, he was walking me through the process of what does it actually cost to do a knee replacement surgery or all of these surgeries. So he started tallying up the material costs. And then he asked the surgeons, what do you think you should make for your X amount of time spent doing a surgery? And he tallied up those costs and he came at, he arrived at costs, and then he started getting calls from patients, and he started just quoting patients these costs. And then he decided to put these prices on his website, and now they're publicly available. The transparency is a really important aspect here. I think we can all agree we have no idea what health costs, because we get one price and health insurance says something else. And it's funny, he was telling me about all of the pushback that he initially got when he started doing this back in the 1990s. People said, oh, it's too risky. You never know what a surgery will cost. There's no way you can put a price tag on it. And it turns out that he could, and he has been very successful. He's been around since then. He's a very strong proponent of this movement.
First question, um, quality. Are these fly-by-night surgeons and doctors, or are these high quality, and how do we know?
That's something that Dr. Smith, I'm sure if you know him, he talks a lot about that. But he has, and some of the other physicians that I spoke with said that the cash-based system actually incentivizes physicians to keep patients as healthy as possible. In our health insurance-based system, physicians bill based on seeing a patient in the clinic and then all of the things that they treat their patient for. A lot of the primary care physicians that I interviewed said, it behooves them to keep their patients as healthy as possible so they don't have to see them as much because their patients are paying a monthly fee, sort of like a subscription Netflix fee. And if they don't see their patient because their patient's healthy, that's good for them. They make room for other patients. And unlike our system with health insurance and coding and billing, the sicker the patient, the more the physician can be reimbursed.
Hmm.
And I think it also sort of adds this free market component where patients can pick and choose. It's not just, oh, my health insurance covers this facility, so I have to go there
Hmm.
regardless. There's a lot more freedom of choice, and physicians and patients, I think, benefit from that system.
Yeah, yeah. No, I think that's a really good point. The traditional system, you whatever you do, the more you do, the more you get paid. In this direct payment model, that's not the case. Because is it sort of a bundled payment? You get paid a certain amount, and then you're responsible for that episode of care, that surgical episode.
Yeah, it depends based on the specialty and based on the physician. These physicians essentially own their clinics and own small businesses, so they can set out their payment price as they want. For the surgical care, it was common to see, just a flat rate fee per surgery type. In primary care, it was typically some sort of a monthly fee. There's also oncologists who have started doing this, and I've seen both monthly fees and I've seen sort of a bundled flat rate for X amount of services per your condition.
Yeah, it's surprising to me how many procedures um, are can be covered in this way. I literally think, from talking to others who are doing what Dr. Keith Smith is doing, um, literally thousands of procedures can be priced and paid for in this way. Just to follow up on the quality, does Dr. Smith and others, there's a well-known orthopedic surgery group out of Chicago that's basically doing something similar. They're I know they actually tout their quality scores. They hire the best, highest quality orthopedic surgeons, and they publish their quality reports. And they basically, say we'll go toe to toe with any academic medical center, any orthopedic group, in terms of quality outcomes, safety outcomes, things like that. So, is that part of what we're seeing in this direct cash movement? Because right.
Absolutely. A number of facilities do publish anything they can around quality. Dr. Smith spoke a lot about the quality of his surgical practice and his surgical infection rate, which was nearly zero, which is much higher in certain facilities. And I think again, it's the sort of free market component of it. You don't have that guaranteed, well, your health insurance covers this facility, so the patients have to come there. But I also think, there's a smaller patient pool, and they really can understand the needs of each individual patient and meet those needs. So I do think the quality, I would love to see a study done on this. There's a very small pool of evidence, but it is starting to come out. I would love to see a study that looks at the quality of care, but anecdotally, from what I hear, the quality seems like it's much higher at some of these cash-based clinics versus not.
so I go to one of these facilities like Dr. Smith's or others, um, and I'm paying out of pocket. But let's say I have an employer that I have a deductible. How does that work?
So, some most facilities that I spoke of the physicians that I spoke with don't interact with health insurance in any way. So there is no copay, there's no deductible. It's $150 a month to come and see me as many times as you need to see me. Or in the case of the surgical center in Oklahoma, it's X amount of money for this surgical procedure from beginning to end. There are a few companies, a lot of small businesses, but also some large businesses. Boeing is one notable example that are offering employees this direct-based care. I think they're
Mhm,
really seeing the economic value of that. And if you think
mhm.
of the cost, I think there are some statistics out there that the average American family spends almost $30,000 a year just in premiums. And I'm sure there's other statistics about what employers are spending just to provide health insurance to their employees. I mean, the figures are astronomical. When you compare that to the price of what you might pay through cash-based or direct primary care, it's significantly lower.
So yeah, that's another question, the cost. So we talked about quality, the cost. Is Dr. Smith's and others, and in your article, you actually cite a few more providers that are doing direct, direct care, contracting or direct care and direct primary care. If I go have a knee surgery, let's say at one of these direct cash centers versus going to the hospital, what's the toe to toe? You talked about the free market. Is it less expensive? And if so, why is it less expensive?
hmm I tried to come up with a very detailed economic analysis comparing the costs. And one thing that's very difficult is to actually get at what is the cost of healthcare when health insurance is involved, and that's very
Mhm.
difficult. It's very opaque. It varies from state to state, facility to facility. So it was actually very difficult to come up with an estimate of what does a knee surgery cost? What's across the country, what's the average? I was able to find a few specific examples. It might be anywhere from $30,000. I saw upwards of $180,000. So, huge extremes. But at Dr. Smith's center, I think it's maybe $17,000. It is one of his more expensive surgical procedures, but still fell below the average threshold of what Americans pay just in premiums. Again, something I would really love to see a detailed analysis on. If you went out of pocket for all of your care, how much care could you actually pay for before you met that same threshold that you're just throwing away in premiums? I would be really interested to see that. But it turns out it's very difficult to to a conclusion of what is the price of healthcare in this country because health insurance really complicates that.
In your article, you mentioned something which I've heard others who are really expert in this field talk about, the notion of rethinking insurance. Actually, you have a section in your article, I think, called Rethinking Health Insurance, where one of the doctors you speak to asks you the question, like, do you take out gasoline insurance for your car or battery insurance or tire insurance? And it's, of course, the answer is no. Why would I take insurance? Because I know I need to fill up my car every week. Why? It's not like it's a catastrophic once in a while event. It's a common thing to replace my tires and so I just pay for it. And so very much the same way, this doctor was saying, it's like, well, just let's do the same thing in healthcare. Why would you pay insurance for primary care? You know you need primary care. Everyone knows primary care is critical. If you have primary care and you use it, your overall cost of care are going to go down and your health is going to go up. That's just almost a fact at this point. We've seen this around the globe. We've seen it here. We've seen the research, decades of research support that. And so it is interesting to sort of say, can we pull something like primary care out of that whole insurance? Because by putting insurance on something that you're going to want to pay for on a regular basis and you're going to use, you actually increase the cost by multiples. Right? You just add all this administrative overhead and overlay, and just the fact that you're insured means they're assuming there's some sort of risk they're taking, and so they have to charge for that. And so in some sense, direct primary care removes that unnecessary insurance part to it. I'm curious what you think of it. And it was just a brilliant part of the article.
That's right. That was Wendy Molotka. She has a direct primary care clinic out in the Midwest, and that's exactly right. She was saying we need to think of health insurance more like we do car insurance. So where we pay for the little things, and then when you get into that big car accident, that's when insurance kicks in. So she and others were saying that the direct primary care and cash-based clinic model pairs well with catastrophic health insurance plans. And I think we're starting to see some policy catch up with that. But I think that is, certainly a great way of thinking about it. Again, I don't think it solves the problem for absolutely every American. I still think we will need some programs like Medicare and Medicaid to subsidize that solution, but I think it certainly moves the needle in a forward direction. And, we have not seen that from any other policy solution proposed in the past decade at least.
Yeah. Where along those lines, you said, we're starting to see policy pick up here. What are you seeing on the policy front that gives you a sense that we're moving in this direction even or yeah, I'm just kind of curious about that.
I think, we're certainly seeing a lot of conversations about the Affordable Care Act. We haven't seen much in the way of policy movement there, but premiums for health insurance plans through ACA marketplaces are rising. One policy change that we did see in Trump's One Big Beautiful Bill is that patients and consumers can now use HSA funds, health savings account funds, to pay for direct primary care. So, if it's $150 per month to be enrolled in a direct primary care clinic, you can now use your HSA funds towards that. So I think, these are
Hmm.
small changes, of course, but we certainly are starting to see some momentum and policy efforts behind this, which I think is, will help.
Yeah, no, I think that is a really huge, like you say, shift in policy and law. That the ability to use HSAs for direct primary care, again, taking it out of that realm of insurance, and just putting it in something. This is what I know I'm going to pay for this. Let me pay for it, and now I could use my HSA dollars to do that. Um, any sort of final thoughts about this? What made you even pursue this? I'm just kind of curious. Why did you write an article about this specific topic about direct, primary care, direct contracting?
It's funny, as a health reporter, it seems like every year we cover the same issues: healthcare quality not getting much better, healthcare costs continuing to rise, politicians continue to debate, they're not really doing much. I really am looking for solutions that could really move the needle and make a difference. And this really did seem like one that could be a great alternative for a lot of people. There are some downsides to it. For instance, many of the physicians I spoke with, they say they go from seeing 3,000 patients a year, 10 to 12 per day, to 300 patients a year, 2 to 3 a day. Now imagine if every physician in the country did that, we would have,
Right,
a major
right.
problem on our hands. We already have a physician shortage, so that would be a huge problem. But I was just after
Mm.
solutions that could make a real difference, and I love that this is a physician-led solution. Physicians are taking it upon themselves to saying, the system that we work in has a problem. Here is a solution. And I think when it is a solution led by the people who really understand the problem, that's when you're going to get a solution that really works and is feasible for, a lot of people.
Well, I don't think I think that's actually a significant point you just raised. I don't think it's a small point. We know primary care, or for those who aren't aware of this, primary care is dying on the vine. It's a profession that literally, the more and more I read, I mean, we might as well start writing eulogies because there aren't going to be primary care folks around. And in large part, for sure, primary care physicians, in large part, the reason why we're seeing the decline is it's just not what people signed up for. People didn't sign up to see, 4, 6, patients and just chug them through. You do primary care because you want to spend time with your patients. You want to get to know them. You want to help them prevent things, not just, solve the immediate, problems in and out. And so I think this direct primary care actually does meet it. It actually serves the profession, the purpose of the profession of primary care, what it was actually created for, and it kind of right sizes that.
Every single primary care physician that I spoke with said how moving to direct primary care allowed them to get back to the heart of primary care, which is serving a patient and serving a community. And, you spoke about quality earlier. When you have a physician who actually gets to know you, who can spend time with you, who you get to spend more than 10 minutes with, they can really understand the lifestyle that you live. And I think that's going to become increasingly important given the rise in chronic diseases. Imagine you actually had a physician on your side who could help you manage that and guide you through that instead of just quick, what's wrong with you? Okay, this is what you should do. I'll see you again next year. As someone who is actually a partner in your health. And that is what a lot of these primary care physicians really enjoy about turning to the primary care model or to the direct care model.
Wow, well said. I completely agree with what you just said and how you said it. That was quite brilliant and a great summary of this. Jess, what a delightful conversation. What a pleasure to meet you. I'm glad that we connected. I did read your article when it came out last month, and I just thought it was fascinating. And so thank you, and hope to be in touch.
Well, thank you so much for having me. This was great. I enjoyed it.
Take care.